This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. Well, good morning, everybody. So I was going to talk for a minute about pulse pressure in trauma. So we talk a lot about vital signs in trauma patients, especially kind of pre-hospital notification. We obviously pay a lot of attention to, trauma activations in an elderly patient with a systolic blood pressure of 109. So we do pay a lot of attention to the blood pressures. But we don't always talk about the pulse pressure. And the idea of a pulse pressure is the difference between your systolic to your diastolic. So normally 120/80, and normal pulse pressure is about 40. A narrow pulse pressure is considered something under about 30. So like blood pressure of 100/75 gives you a pulse pressure of 25. And that is kind of a weird blood pressure to see the systolic and the diastolic so close together. And, there's an idea that a narrow pulse pressure happens when the body is trying to compensate for something like acute blood loss, and the body is kind of clamping down on the vasculature, and you get this narrow pulse pressure, and you're not quite hypotensive yet, but it could be like a sign of impending circulatory collapse or ongoing bleeding that the body's compensating for, especially in potentially younger people who can do that, and they can basically pressure themselves and their pulse pressure gets narrow. So there's a possibility that could be a sign to, predict badness in trauma. And there was a study recently that looked at pre-hospital narrow pulse pressure, and they looked at a large number of patients who were coming into a major trauma center, and they looked at things like, injury severity and bad outcomes. And what was interesting is that the people with the narrow pulse pressure were not as bad as people who were frankly hypotensive, but they definitely were worse than people with normal blood pressure. So for example, they looked at injury severity score and people who were severely injured. In the hypotensive patients, it was 37% of hypotensive patients had severe injuries. It was about 22% in the people who had a narrow pulse pressure and only 11% in people who had normal blood pressures. And when they looked at things like the need for thoracotomy, death, cardiac arrest, need for other interventions, it was all worse in the hypotensive patients. And then the narrow pulse pressure people were in between the hypotensive and the normotensive. So it's definitely something that probably has some validity. And when we're, whether it's a call from EMS or we have a trauma patient here and we see a narrow pulse pressure under 30, we should pay close attention to people. Maybe they do need blood. Maybe we should definitely stay on top of those people a little closer. So kind of one more part of the vital signs to look at in trauma patients that we don't always think about that could be important. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.